if this sounds familiar to you. The front nine feels great. You are joking with the guys, you're up a couple skins. Then somewhere around hole 12 or 13, your knee is now starting to quietly talk to you. By the 18th hole, you're not really playing golf anymore, you're more surviving. You're counting your swings, you're counting your strokes, you're like, how quickly can I get back to the cart? And where's my ice pack? And why is my ibuprofen already wearing out? And look, you did what you're supposed to do, right? You saw a doctor, you got your x-ray, you even got your cortisone shot. Big thumbs down to that one. But it helped for a few weeks, and now somebody's already mentioning the word surgery, even though nobody has really offered you a real plan in between. My name is Dr. Gayan Poovendran. I am a medical doctor who specializes in sports and regenerative medicine. For the last 15 years, I have helped thousands of golfers conquer their knee pain without resorting to invasive surgery. In this video today, I am going to show you the 3 non-surgical levers that actually move the needle. This is targeted strength training, smarter inflammation control, and the right supports. And also where regenerative medicine treatments like PRP or microfat or bone marrow also fit into the next step on your treatment plan. This is not a last-ditch Hail Mary. By the end, you will know one specific routine to start this week and how to know if you are a good candidate for those injections. Before we dive in though, if you want something that you can use before your very next round, I have put together for you a free 5-minute warm-up guide specifically designed for golfers that have knee pain. I call it the Ready for Tee-Off guide, and you can get it right now at readyforteeoff.com. It is an absolutely free PDF with 6 illustrated exercises that you can pull up on your phone in the parking lot so that your knee is actually ready on the first tee, not waiting until hole number 7. So go grab it, come right back, and I promise I'll be right here. All right, here is what I see in my office every single week. On the outside, the problem is super simple. Your knee hurts. It swells after rounds. You may have a diagnosis or a label of arthritis or a meniscus tear, or you just call it a cranky joint, but the headline is the same. Your knee is not handling the load of your life and your golf swing. Now, underneath that, it gets a little bit more existential because there's an internal problem here too. If you're like me, which I think you are, you still see yourself as an athlete. You still invest in your health and you are not ready to feel old. But the modern medical system gave you a 4-minute visit, they gave you a cortisone shot, and then they told you, come back when it hurts again. No roadmap, no treatment options, no real education, just a countdown. And there's a deeper philosophical problem here. A guy like you who works this hard on his life and his career should not be told that you're just getting old. You just need to keep living with it until we replace it. You deserve a conversation like this one. Here, these are the non-surgical levers. Here is what PRP and other regenerative medicine tools are and how they fit. And also, here is the one thing to start doing this week. Guess what? Lucky for you, that is a conversation that we're gonna have right now. So let's give you the 3 non-surgical levers that you can start pulling right now. No doctor really required. The first one is targeted exercise. This is not go to the gym more. This is go to the gym smarter. This is targeted strength. That means building up the muscles that protect your knee. That is the quadriceps, your hamstrings, your gluteal muscles, your hips. There are large studies in people that have knee arthritis, and it shows that strength programs reduce pain and improve function compared to doing nothing. Stronger muscles act like shock absorbers. They take part of the hit every time you walk or squat or swing. So that way the joint doesn't have to do it all alone. For a golfer, that matters most at impact. When you load into that lead leg, a strong hip and thigh means less panic inside the joint. Now, here's the part where PRP connects. PRP, or platelet-rich plasma, is usually one of the first line regenerative steps that I take with my golfers. I take some of your blood, I spin it down, and then I inject the healing proteins that are in the platelets as well as the growth factors into the knee under live ultrasound guidance. There are multiple trials and reviews that show that PRP can provide better pain relief and function than placebo or the hyaluronic acid or rooster comb injections or steroid injections, and this goes out to at least 12 months. for many patients. But here's the key idea. PRP works best in a knee that is supported. So if your muscles are weak and your movement is off, then PRP is going to work in a bad neighborhood. Strength and control turn the knee into a much better place for regenerative medicine to do its job. Strength is not instead of regenerative medicine, but it is one of those things that makes regenerative medicine worth doing. My second lever for you is calming the fire in a smarter way. The old routine was always something like this: some anti-inflammatory pills like ibuprofen, cortisone injections, maybe a stronger pill like diclofenac. The problem is that repeated cortisone injections weaken the tissue and they speed up wear and tear if you lean on it too much. I've seen this in my own practice with patients that get multiple cortisone shots. I watch their knee deteriorate. Cortisone does a good job at turning down the fire, or turning down the inflammation or numbing the pain, but the end result is it's only turning down the smoke alarm volume while the fire is still burning. What I want for you though is a knee that lives in a lower state of inflammation every single day. Now, simple at-home steps for this are very brief periods of rest, the key word being brief rest during an acute flare, putting the leg up or elevating it, and alternating between ice and heat. Now, I don't talk a lot about ice because I prefer heat, but ice is best when the knee is acutely hot, it's acutely swollen, and the pain is sharp. I like heat in almost every other situation: for chronic knee pain, when there's stiffness, when there's tightness, just when you're trying to loosen up. There are clinical reviews that support these basic home tools as useful and low-risk ways to reduce pain and swelling when they're used consistently. Now, on top of that, there is a decent amount of evidence that things like ginger and turmeric can also modestly reduce arthritis pain over time in some people. Now, they are not magic, but they may also help lower the background noise when they are a part of a larger plan. My other piece of advice here is implement these as food as part of your diet. I think it works better than just taking a supplement. But why does this matter for regenerative medicine? Well, PRP and microfragmented fat and bone marrow, they all send healing signals into the joint, and if that joint is already irritated, the whole system is inflamed every single day from sleep and weight and stress and inactivity. Well, those signals end up fighting an uphill battle. So when we turn that background inflammation down, those same injections have a much better chance to deliver noticeable relief. They work as anti-inflammatories too, so if you had them have to put out the anti-inflammatory fire, they have less chance to turn into cells that are going to heal. The third lever I like to talk about is giving the joint help from the outside and from water. A large analysis comparing non-drug treatments for knee arthritis found that knee braces and exercise and hydrotherapy were among the most effective options for improving pain and function. Warm water exercise programs in particular have been shown to reduce pain and improve strength and mobility in people that have knee arthritis. For you, that means a properly fitted knee brace can help offload sensitive parts of the joint and make walking 18 holes a more realistic proposition. Working in a warm pool lets you move through your range of motion and build strength with less load on the joint, so you're not beating up the knee every time you're trying to make it better. These supports buy you time and function while you strengthen and decide whether you need to climb that regenerative medicine ladder. Now, let me lay out really quickly how the regenerative medicine options actually work and stack, so that you're not stuck with just some random marketing messages on Facebook. PRP is where most golfers start when strength and smart care are not enough. As I said before, PRP is just we take some of your blood, we concentrate it down, and we take all the healing part of your blood and put it back into the knee to turn up the repair signals. Research shows that PRP beats placebo, hyaluronic acid, and steroids for pain and function out to about a year in many patients that have knee arthritis. Now, in practical terms, a lot of people get 6 to 12 months of noticeable relief and better function when doing PRP, again, compared to the standard of care that we're always doing. My next tool is microfragmented fat. So when PRP needs a backup, if the joint is more worn down or there's more structural damage, or if the PRP only partially helped, we can always add something like microfragmented fat. These are stem cell type procedures. We gently take a small amount of fat from your abdomen, so you get like a little liposuction out of it. We process those cells and we inject that back into the knee. Studies and case series show that MFAT can actually reduce pain and improve function for up to 24 months or longer in many patients that have moderate to severe arthritis, and it often helps delay joint replacement surgery. The third tool in my arsenal is something we call BMAC, or bone marrow aspirate concentrate. This is a higher grade option, again, for more advanced problems. So for my more advanced arthritis knees, or if PRP and microfat weren't enough, or when I looked at the patient, they weren't the right tool, I look at something called bone marrow concentrate. This one sounds a lot scarier than it is, but what we do is we take bone marrow from your pelvic bone, we concentrate the stem cells from it, and then we inject it back into the joint. There are lots of comparative studies that suggest that bone marrow and PRP are both safe, and they're both effective, and that bone marrow offers similar or sometimes greater improvements in pain and function in tougher cases. Again, it's more invasive, so I hold it for more advanced cases or in times where PRP on its own fails. The big idea here is that we are choosing the tools that are right for you. We start with the basics, and if these aren't enough, we can add more advanced layers depending on what you need. Not everybody needs stem cells using their fat or stem cells using their bone marrow. Some people, PRP is just enough. If you're watching this video, the exercise probably wasn't, so now we're giving you some extra tools. All right, I know that's a lot, but let's go back to one behavior change that I want you to walk away with today. Start with a simple 10-minute strength and warm-up routine for your knees at least 3 days a week. Not when it hurts, not when you remember, not only on the days that you play golf. 3 days, 10 minutes, non-negotiable. Now, let me give you 3 reasons why this is really important. Reason number 1 is it makes every future injection more valuable. If you do this, you build stronger legs and cleaner movements. So if and when we add PRP or microfat or bone marrow or a combination of those, that biology is working in a joint that was already primed and supported. You are stacking tools instead of just hoping one injection saves the day. And if you don't do that, well, even the best injection ends up working in a weak and angry joint. So you may get a little bit of relief for a short period of time, but it is less likely to be strong and long-lasting. Reason number 2 is this helps you buy time and options before surgery. If you do this, again, smart strengthening, smart inflammation control, smart uses of braces and aquatherapy, and if indicated, regenerative medicine, this can buy you years of better golf and better daily life. And it may also help delay or avoid your knee replacement entirely. Surgery stays a choice, not a countdown. Now, if you don't, you are more likely to end up riding that cortisone roller coaster and merry-go-round until the joint is so far gone that the only option offered to you is schedule your knee replacement. The window where these things work continues to shrink. And reason number 3, you get to protect your identity as an athlete. If you do this, you're acting like the athlete that you still are. You're using the same categories of tools that the professionals use that help them stay in their sport. It's, again, strength training, smart warm-ups, targeted regenerative medicine when they need it. If you don't do this, the story starts slowly shifting to, I guess this is what getting older feels like. Even though the evidence says that active, motivated adults often respond really well to a combined approach. Now, here's the win that I really care about. It's really simple. For you, 6 to 12 months from now, you are walking off hole 18 thinking about your score, not your knee. Whether that's from the strength work alone, or strength plus PRP, or strength plus stem cell injections, I don't care. I just want you to feel better. Let me give you one move that you can start today that fits directly into this 10-minute routine. Today's move that I want to talk about is called the reverse lunge with overhead reach. Here's how you do it. You step 1 foot back into reverse lunge, kind of like you're taking a comfortable step backwards. You are going to lower your knee back towards the ground. As you lower your knee, you want to raise both arms straight up overhead, keep your chest up, and then push through your front heel to come back to standing. Switch legs each rep and aim for 1 set of 6 repetitions per side. My coaching cue here for you is the overhead reach part of this exercise is not optional. It is going to open up the hip flexor on your back leg and activate your glute. Your hip flexor on the front is one of the tightest muscles in guys who sit at a desk all week. The tight hip flexors end up pulling on your knee, and this exercise helps undo all that negative balance. Why does this exercise help? Well, this move helps stretch your hip flexor on the back leg and fire the glutes on the front leg. When those 2 muscles pull their weight and are in balance, the knee does not have to do all the work every time you walk on the course or every time you load your lead leg. And for that complete 5-minute routine, go grab the free Ready for Tee Off guide at readyforteeoff.com. Again, it has illustrated instructions for all 6 exercises that I recommend, and you can pull it up on your phone right before every round. So here is your plan. 3 days this week, 10 minutes. Do this reverse lunge with the overhead reach plus 2 other exercises from my Ready for Tee Off routine. That is going to be your new baseline. If your knee has already been through cortisone and rest and this whole merry-go-round, and you're wondering now if you are a good candidate for PRP or regenerative medicine treatments, this routine is still step 1. It proves to your body and to me that you are serious about staying in the game. And if you have a buddy in your group who always rubs his knee on 16 but never wants to talk about it, send him this video and send him the guide. You might keep him on the course for a lot more Saturdays. I hope this was helpful. I'm Dr. Gayan Poovendran. Your best round is not behind you. I will see you next time, pain-free on the fairway.